Dr. Shobhit is here. Dr. Giridhar sir will be speaking for combo therapy, PDT plus
Earlier person
anti-VEGF.
has not come. He has not come for the AIOS. The moment he heard that he has to talk on Earlier, he cancelled the program. And yesterday I sat in the same chair where Paritosh is sitting, where Rohan Chawla was a co-author for a paper on PDT for PCV from RP Center. Anyhow, I mean, that's the debate. That's the debate. So I'll be talking on combination therapy. That's what I do. So for patients with polypoidal disease, Rohan said that the polyps remain even after PCV, I mean after PDT. The BVN remains after PDT, but in ranibizumab, polyps and BVN remain. So what you have to decide what you want. You want both the polyps and the BVN. So the Everest data actually, which two data which the debate of course is between combination therapy and monotherapy, and the 24-month data actually was recently presented by the Everest group, and basically, I mean, the visual acuity improvement was far better in the patients who had received combination therapy when compared to the monotherapy. And most importantly, polyp regression, because unless you have polyp regression, the disease comes back even faster. And again, as per like the Everest one, the difference was far, I mean, nearly 2/3 and 1/3 in the two groups. Now, Rohan said that the number of PDTs were quite high in the first year, but surprisingly in the second year, the need for PDT was far, very few number of patients, less number of patients needed PDT in the second year. So based on the Everest 2 study, there is enough evidence to say combination therapy is a very superior treatment to monotherapy. Now we have a series of patients where we have done this in good visual acuity, and many of these patients, 23 eyes, had initially monotherapy, no response, and therefore they were shifted to combination therapy. And interestingly, 17 eyes with a mean follow-up of 27 months did not show any recurrence at all. Now these are some of the cases that we had in that series. You can see here subfoveal polyps treated with half-fluence and anti-VEGF, and you can see here post-treatment 1.5 years follow-up, no recurrence. Now this is another lady who's been under my care for many years now, 10 years. From 2009, she has received 4 cycles of PDT, and then in recurrence, when recurrence came in July 2016, I gave her Eylea thinking it will be good, but with Eylea she did improve, but you can see here the improvement after Eylea, but then it comes back with a bang within 3 months, so that's the short duration when we have the effect. So finally she had one more cycle of PDT with Eylea, and after that she is now okay for nearly 1 year. So even after 4 cycles of PDT, she still has good visual acuity of 6/9 in that eye. Therefore PDT doesn't do much of harm as many people really claim. Now this is what monotherapy does. You can see here, if you want patients, I mean, if you have about 10 to 15 patients like this, you don't have to work very hard. They come to you every 6 weeks for a shot. You can see here continuous injection with ranibizumab monotherapy. You can see here every 6 weeks, and finally I shifted him to Eylea, and Eylea also you can see here max 6 weeks of a dry macula, but then he comes back to you with a recurrence. But he is an extremely rich man. He can afford all this. He has had about 14, 18 injections of Eylea now. He continues to have a one-eyed patient. He is not keen on photodynamic therapy, but that's the Planet study is a skewed study because they use PDT only as a rescue treatment, not as a primary treatment. Therefore, it cannot be compared with Eylea. So this is my last case here. You can see here, this is a gentleman, one-eyed patient. Actually, you can see the other eye lost due to advanced PCV. The left eye, he came with a recent episode, and he had peripapillary polyps, which I treated initially with multiple doses of Eylea. He did well, but then within a short period of 2 months, he came back with a recurrence. You can see the recurrence here. There he's come back with a bang, with again a recurrence, and this time he was willing for combination therapy, and he recently had a cycle of PDT with anti-VEGF injection, and following that, you know, his macula is dry, and within 1 month, and his visual acuity also is good. Therefore, I would like to conclude that combination therapy is a very safe and effective treatment of polypoidal disease. Regression of polyps is achieved. BVN may remain, but BVN usually doesn't create much of hemorrhagic changes. It's the polyps that cause hemorrhagic changes. And in our experience, 50% of the treatment patients are likely to have recurrence in the first 2 years after treatment, but the quiescent period is at least minimum 14 to 16 months after 1 cycle of PDT therapy. But there is a reasonably large number of patients who do not get recurrence even after 2 years, and it's very safe treatment for polypoidal disease.